Hi, I'm Dr. Paul Zwiebel. I'm a plastic surgeon here in Denver, Colorado. Today I wanted to talk with you about capsule contracture. After breast implant surgery, one of the bad effects that can occur in a small percentage of patients is capsule contracture. What is capsule contracture? Think of the result of breast augmentation that you really don't like tennis balls right under the skin. They look round, unnatural, and they feel firm. That's a capsule contracture. Well, why do we call it capsule contracture? Well, let me define the term capsule. It's actually just the lining that the body forms naturally around the implant after surgery. This lining really serves a multiple of purposes. One is that it's kind of a barrier between the implant and your tissues, the muscle and the breast around the implant, which is nice. It's a little bit of a protective barrier. But one of the other really important things that the capsule does is it creates a smooth gliding surface so that the implant can move and feel soft and natural. However, if that capsule contracts, if it gets very tight and confined around the implant so that the implant can't move, the implant ends up feeling very firm and it creates that tennis ball distortion. It also won't move at all, so as the person moves, the breast doesn't have a natural appearance to it, it doesn't flow. When we get a good capsule, one that's thin, soft, supple, and also large enough to allow the implant to move, we end up with a very nice, soft, natural appearing result. So how do we get a good capsule, and how do we avoid the capsule contracture? Fortunately, the occurrence of capsule contracture is going to be roughly less than 5%. And it's very important that we as surgeons do all that we can do to help prevent the capsule contracture, but there are actually some things that you as a patient can do that make a big difference. For example, we know that capsule contracture is more likely to occur if there's any kind of bleeding or oozing in the space around the implant after surgery. So it becomes very, very important that for a full 14 days before surgery, you stop any aspirin or ibuprofen, fish oil, and even multiple vitamins and herbal supplements, because many of them can actually thin the blood so that there's a little bit more oozing after surgery. Getting on to other things that you can do to help prevent capsule contracture, after surgery, it's really important that you take the time to recover well. With surgery, you only get one chance to recover well. So during those first 6 weeks after surgery, that's the time when that capsule, that lining around the implant, is being formed by the body. That's the time that you have to let your body form that ideal capsule. So what we want to do is have you minimize any trauma in that area, any increased irritation. Now obviously when we're done with surgery, there's a certain amount of irritation to those tissues. But we don't want to add on to that irritation by having you contract the muscle intensely. So we wouldn't want you to, for example, be doing any kind of exercise or lifting more than maybe 15 or 20 pounds, which would make the chest muscle contract intensely. Further, any high impact activities, bouncing, jumping, jogging, will also create more irritation. Once the capsule forms, again, that lining protects the tissues and it won't be irritated by the implant. But in that early time after surgery, that's just a raw tissue surface and it's not really ready to handle the motion of the implant. So the irritation creates inflammation, which results in scarring and a capsule contracture. So for 6 weeks after surgery, no high impact activities, no big arm swinging like you might do playing tennis or golf, and also no lifting more than about 15 or 25 pounds. So those are some of the keys to help avoid capsule contracture after breast augmentation surgery. I'd love to have a chance to talk with you personally about breast augmentation, so if you call me at 303-470-3400, we can set up a personal consultation. Thanks a lot for listening.